I've taken some tests on Johnny, and the results have come back showing he has alcoholic liver disease. Unfortunately, there is significant damage to the liver, so he will need a new one as soon as possible.
Okay, thanks, doctor.
Hi, I'm Johnny. I'm 30 years old and I've been diagnosed with alcoholic liver disease. My diagnosis is severe enough where I'm in need of a donor. I must say, I'm in somewhat disbelief about this whole situation.
Okay. When I was first told about Johnny's need of a new liver, I can't say I was completely surprised. I've known him, and I know he's had issues in the past with alcoholism, and from what I've heard, he's been in pain recently. Of course, me being his friend, I want to help him.
The inflammation of the liver due to alcohol abuse has caused alcoholic cirrhosis, which is where liver cells are killed and scar tissue is formed. It is obvious that Johnny has been drinking for several years, and the damage caused from the alcohol cannot be undone.
The doctors are saying that I gotta get a liver transplant because of my overconsumption of alcohol, which is probably not true, but whatever.
I've known Johnny for 12 years, and the entire time I've known him, I've noticed he had a drinking problem. I've tried to tell him, but all he does is deny it. I'm gonna have to take the test to see if I'm a match, and I had a big decision to make at this point.
Johnny's best friend Eric has decided to take some tests to see if he's a match or not. Right now, the chances are looking good considering Johnny and Eric are the same age and have similar body sizes. Eric is a healthy young man, so we will have to wait for the results of his blood test that will determine whether or not he's a match.
Guess what? We're going through with the surgery.
What do you mean?
We're a match. I can donate my liver.
That's hype, bro.
The first step of a liver transplant is prepping the patients and performing tests so they can get approved for surgery.
These tests include a blood test, chest x-ray, electrocardiogram, and an abdominal ultrasound.
Prepping for the surgery, we were told of the complications, but we still wanted to go through with it.
Doing an operation like this, we knew that there was a possibility of failure to remove the liver, as well as the recipient's body not being able to accept the new organ.
On top of everything, there is risks of infections, blood clots, internal bleeding, and mental confusion or seizure.
Eric and Johnny take sedatives to help them relax before an intense surgery. At the same time, the surgical team sets up and prepares for what is expected to be a 12-hour surgery if all goes well. In operating room 1, Eric is put under anesthetics and Dr. Haggerty starts off the partial hepatectomy surgery. She first makes 2 incisions, one on each side of the belly below the ribs. She then carefully separates the surrounding organs and structures like the inferior vena cava, portal vein, common bile duct, and the hepatic artery. After the organs are well isolated, Dr. Haggerty continues to remove the right lobe, which makes up 40 to 60% of the liver. After the portion of the liver is successfully removed, it makes its way over to the operating room 2, where Johnny is ready to receive it. A few hours earlier, Johnny goes through the same procedure as Eric, with similar incisions and separation of the organs. In order to stop blood flow into the diseased liver, the attached arteries and veins are clamped. At this point, the liver is now ready to be removed and disposed of. Once the liver is checked over, it is implanted in the body and attached to the blood vessels to start the blood flow to Johnny's new liver. The incisions are closed with surgical staples, and Johnny is sent to his room for recovery. Transplant recipients need to take a large array of medications after surgery. Some will be new medications prescribed after the transplant, and some medications may be continued from before surgery. Even years after surgery, doctors will continue to monitor the health status of both the transplanted organ and your whole body. Consistent laboratory tests are a regular part of the transplant recipient's life.
It's been about 10 months that I donated my liver. I've been in and out of the doctors consistently for checkups, and at this point, I can say I feel pretty good. The first 5 days I was hospitalized, and I specifically remember the first 24 hours I was really sore and unsteady. The first 12 weeks after leaving the hospital, I slowly returned to my everyday activities, although I did have to make sure I wasn't lifting any more than 15 pounds. The first couple months overall were by far the hardest part of this entire operation. I had to spend lots of time to heal and make sure there's no complications. Over the rest of the year, I'm continuing regular blood tests to assure that everything's okay. At this point, my liver is apparently fully grown back.
Immunosuppressants are a huge part of my everyday life. They are used to prevent my body from rejecting the new liver. Unfortunately, now my immune system is slower and weaker due to the suppressants. This means I'm more vulnerable to infections and find it more difficult to recover from illness.
Alcoholic liver disease is an extreme medical condition caused by the excessive consumption of alcohol over several years. Putting yourself in a position where you are in need of an organ transplant is guaranteed to decrease your overall quality of life.